Welcome to your quick guide on how to calculate medication doses, an essential skill every nursing student must master. No more second guessing. Let's break it down step by step. Medication errors are one of the most preventable causes of harm in healthcare. As nurses, we're often the final checkpoint. Accurate dose calculation can literally save lives. The most common formula used in med math is desired have X quantity equal sign X or D, HXQ equal sign XD is the dose you want to give. H is what you have on hand. Q is the quantity, tablet, ml, etc. X is what you'll administer. Example 1. Doctor orders 500 milligrams, you have 250 milligrams tablets. 500 divided 250 equals 2 tablets. Easy, right? Let's try a liquid medication example. Order. 75 milligrams available. 100 milligrams per 5 ml. Use the same formula, 75, 100 times 5 equals 3, 75 ml. You'll draw up 3.75 ml into your syringe. Need to calculate IV drip rates manually using drop factors. Use this formula, volume x drop factor, time in minutes, equal sign GAT min example, 1000 ml over 8 hours. Drop factor 15 GAT ml convert time, 8 HRS equal sign 480 minutes, 1000 x 15, 480 equal sign 31.25, 31 guitar min. You'll adjust your roller clamp to deliver 31 drops per minute. For IV pumps, it's even simpler. Volume ml, time HR, equal sign ml HR example. Give 500 ml over 4 hours. 500 divided 4 equals 125 ml HR. That's the rate you'll enter into the pump. Want to get faster and more confident? Use AI tools like SharePath AI, ChatGPT, or Quizlet AI to generate custom practice problems. Try prompts like, give me 5 nursing med math practice questions with answers. Create NCLEX-style medication dose questions using DHXQ. Explain how to calculate IV drip rate for nursing students. AI helps you get instant feedback, clear explanations, and unlimited practice on the go. Always double-check. Right drug, right dose, right route, right time, right patient. Watch for unit conversions, mg versus mcg, ml versus L. Use a calculator until you're confident, don't guess. Ask, verify. You've got the tools to calculate med doses safely and accurately. Use the formula, practice daily, and lean on AI tools to build your confidence. Subscribe for more nursing success tips, because safe nurses are smart nurses. Stay safe, stay sharp, you've got this.